Okay, you guys, so I'm back with another video today. So today I'm going to talk about some struggles and tips that I have for nursing school. Some struggles that I dealt with throughout nursing school, and also some tips to help you during nursing school. This video has been highly requested by a few of my subscribers. But first, just want to say, if you're new, please subscribe below, and so let's get started, y'all. So let's be real. So nursing school is very difficult and time consuming, and it can be very overwhelming if you don't know anyone that has been through nursing school and you don't know what to expect. I would say a big struggle in nursing school for me was the test exams. The test exams, sometimes in nursing school, you will sit there and study your butt off for hours and for days at a time, and then when the time for the exam to come, you see none of the information that you studied for on this exam. Like, you probably studied the cardiac chapter like for hours and hours, and you only see like one question about the heart on there, or you see like 2 questions about musculoskeletal, and you study that for days and days, and it's like the things that you didn't really pay attention to is not on the test. And then the end result is that you failed because you don't know most of the information on the test. A tip that I would give you is to go to the professor, talk to the professor, see if they can help you to do better for the next exam. Maybe ask them what type of material they need to study the most for the next exam. I mean, sometimes they're not going to tell you, but I feel like it doesn't really hurt to ask. At my nursing school, some of the professors was really nice. If they really see that you were struggling, they would actually help you, not physically help you on the test, but they would point out, okay, like, you really need to focus on this material for the test, or you don't really need to focus that much on this, but just a little bit, because they're going to have a few questions on there. So I would say that. Also, a big thing with the exams is the fact that these questions on the exam aren't like regular questions, like how many beats does the heart make per minute, or what is the function of the kidney. It's not as simple as that. These questions are NCLEX style type questions, where you have to apply all the knowledge that you learned from whatever system, and you have to apply it to the question what they're asking you. Pretty much these questions most of the time are asking you pretty much what is going to kill the patient first. That, I feel like that's the best way to answer and get the questions correct, because sometimes, which is so annoying, is that these questions could have multiple answers that are correct, but which one is the most correct? I know that sounds so stupid, but that is true. These NCLEX style questions, the answer that you need to choose is pretty much what is going to kill the patient first. Even though most of the answers may seem correct, you need to decide, okay, if someone went into cardiac arrest, if one of your patients went to cardiac arrest, and the choices were to you should put the EKG leads on the patient and get a heart rhythm, or you should start CPR, 3 you start an IV. Obviously, which one is going to save this patient the most? And starting an IV is not going to be one, because he's not getting any compressions, and you're just trying to sit here and deal with his arm. Putting EKG leads on him to collect a rhythm strip, obviously we know he's in cardiac arrest. That is not important right now. So the answer that you need to choose is to do immediate CPR. So it's those type of questions that you're gonna encounter, and you just really need to know how to answer those to the best of your abilities. Another challenge in nursing school, I would say, is procrastinating. Pretty much putting assignments off because you have other things to do that you feel that are important. And when it's time to do that assignment, you have like a million other things to do on top of that. A lot of things can really pile up in nursing school. You can have a test coming up in a month and you think, okay, you know, I can study in like 2 weeks, and then in 2 weeks you have clinical assignments that needs to be done in the same time around the exam, and then now it's time to study and you need to also do these clinical assignments. It can be a whole lot. So my advice would be to get a planner, pretty much plan your life. You know when this exam is coming, pretty much study. And you don't have to study every day, but most of the time throughout each week. Do your assignments ahead of time when you know that it's due. So if it's due in 2 weeks, I would say start it today just to knock it out. I mean, because the quicker that you do things, the less stress that you will have. And nursing school is already a lot of stress on its own. So procrastinating is just not going to be good for you, and you might get a stress also. Another thing I would say is to never put yourself down. I know sometimes that can be very hard when you're studying with different people and you took an exam and you're the only one that failed the exam while everyone else passed, and you're sitting here wondering like, what am I doing? Like, what am I doing wrong? You know, feeling that you're dumb. You're not dumb. You know, maybe you just didn't study the same information that they did, or maybe you didn't use the same process of studying that they did. Just don't put yourself down. You know, try and get help or use other type of resources, and then you'll do better. And the last struggle, I would say, this is for me, the last struggle I would say with nursing school is not having a social life. Sometimes that can be very hard. If before nursing school you was always out and about, but when it's time to be in nursing school, you have all these exams, clinicals, these long class days that can go from you being there at 7 o'clock in the morning and leaving at 4 p.m. You know, sometimes that can pretty much change your social life, and you can't go out as much as you want to anymore because you have to study, which is very important. Can't be on the phone all the time scrolling through Instagram or whatever you want to do, because that's no longer important. What's important is trying to get through this nursing program at the end of the day. So you have to pretty much put your social life on a halt, and get people outside of nursing school to understand that, and just make them realize that I'm not doing this because I don't want to be with you, I don't want to hang out with you. It's really because if I do continue to play around, I'm gonna get kicked out because I've failed so many tests. That is a big struggle, and pretty much changing your life around. And positive note I would say with nursing school is just keep your head up high. You know, if you fail one test or a second test, it's okay. You know, you're not the only one. Okay, there are a million people that has failed multiple tests in nursing school and are your nurses today. So it's okay. Just because you failed a test don't mean that you're not smart, don't mean that you're not going to graduate. You will. Just keep your head up, keep moving forward, cry right now, wipe the tears, and continue to move on. It's gonna be okay. It's gonna be okay. So yeah, also just remove the negative people out of your life through nursing school, because you don't need any stressors in nursing school, because that's a stressor enough. Those are just a few struggles that I had through nursing school, and hopefully this video helps some of y'all out that are in nursing school. Just continue to stay strong, think strong. You're gonna get through it, and then eventually you can tell me that you don't pass NCLEX and you are a nurse. Okay, so it's gonna be okay, y'all.